very long presentation, so don't worry, I will try to keep the time. So I'm going to present what a group of experts worldwide tries to bring out, that we need to harmonize our approach on occupational health surveillance and EPI, and we created for this purpose a roadmap. If you think of what is usually done at the workplace when people really care about occupational health, those people that go to the work sites, those people that have to control whether the stuff is done correctly, you first gather information from studies like we heard in the last 3 days here over and over again, like what is known about toxicology, about exposure, about material characterizations, and so on. Then they try to put this data together to assess the risk. That's, I would say, a symposium on its own already, what methods exist there. Then they go out and apply control strategies, hierarchies in approach. They might do health surveillance of workers that are identified as having an elevated risk. And more and more common is nowadays that in companies, the same people that assess occupational health risk and manage that risk, they also are involved in product stewardship, so they establish or help establish material safety sheets, REACH dossiers, and so on. So this product stewardship, you want to know what is your customer doing, and you help your customer reduce their risk. And customers are often not people that go into the store, but they are often people that use the product for their production, so it's also occupational users. We have quite some efforts ongoing in Europe, funded research in Europe, in Asia, and in the US, Australia also, about most of these points. But we heard it's like we see the first minute, small studies now coming, doing health surveillance. There are multiple reasons for not doing that. I want to address a few of them. We heard already about some of the questions like that. We don't know what really to assess, what are the metrics, and so on. But let's think first of how do health professionals at the workplace, how do they try to reduce the mass of information? And this is just some of these occupational health paradigms that we know about particles. In the past, that means about 40, 50 years ago, it was simple. You had like basically 3 concepts. Particles can either overload the lungs, they can carry toxic substances, and they can do all kinds of stuff in your body, or they are fibers, permanent fibers like asbestos, and can then do harmful things. Then in the 90s, we realized from air pollution research, there's something else going on, that ambient particles, they are not carrying extremely toxic substances in high enough quantities to explain all the types of effects that are observed in the population. And then we saw many researchers, a lot of research done on combustion particles, on ambient fine particles, and later on ultrafine particles that over and over confirm, hey, there are particles that produce toxic substances. And I'm not talking of just the metabolization of a substance that you inhale and then gets toxified and then acts toxic, but we create ROS, these radicals, and maybe also other substances on the surface of particles. So it's a new concept basically, and we are still trying to understand how we can address these issues, and how to protect is kind of clear. We can of course prevent workers from inhaling those particles, but other ideas how maybe we could support that, how we could reduce the particles if we can control them, they are still ongoing, and I think we have a lot of work waiting there. I just brought up this to show, okay, we have like we have a huge range of material properties. They then reduce into lesser range of cell endpoints, like cell effects. Some of them will get into systemic manifestations that may then lead to health effects, and somehow we need to reduce this to those people who have to do the intervention. That's why I show these health paradigms. Maybe we can improve them, maybe we can add some more classes, but we have to keep it simple so that the people who have like 5 minutes per workplace can spend those 5 minutes in a valuable way. Okay, I just jumped over this. So how do we assess occupational health effects when we do research? We study exposure, we study health effects, and we do the data collection and data treatment. So when we look at the exposure, we heard about, well, which industries are needed. So for example, in Switzerland we did this nano inventory. The Dutch did something similar. In the US we heard they had some qualitative surveys about that. So we start to understand which industries are really using the workers. We understand approximately what nanomaterials are already in production, but we're already one step behind. We basically learn that something is new on the market after it's put on the market. So that's basically too late to be proactive. We are still struggling with understanding how long, how often people are exposed at the workplaces, because simply in the few studies that are published, often this information is missing. So you might learn that at X workplace they found this concentration. You don't know, is ever a worker really working there, or is this like a control unit where once per day somebody goes by and makes a quick readout, or is this where somebody works 8 hours a day? We don't know about the protection measures then about these people. We just heard before, this was an important question. If they really wear their masks, and if it's the right mask, they might not have a high exposure while they are in the production site. But maybe their clothes are full of particles with 30 milligrams per cubic meter. I would expect that they are getting loaded. So when they go into the break room and take off the mask and then play cards, they might stir up all the particles and inhale at that moment the particles. So we might have missed the right place to assess the exposure. So there are many questions that you can ask, and we need to move on in that. We need to know more about that. Health effects. Which acute effects, which long-term effects are the markers of early response? Enrico gave a nice overview what is known already, and there are a couple of people out now that also ask the question, what should we know, and we don't know yet. And then the last part is the data collection. So of course we need to answer all these questions that are listed here in the exposure and the health section, and then that's the what data, but also which cohorts should we observe, how can we collaborate across continents, and there are quite some challenges. It's still not clear which metrics to assess. We heard this over and over again. The exposure people, they know to measure, but they don't know is it the right metric. The tox people ask, well, we see changes, but we're not sure which metric really makes this modification. We still try to tackle with that. And so, of course, for those people doing occupational health studies, those questions combine, and we are still like, ooh, what should we do? And another point that we saw in our Swiss study was that, and it was confirmed for other countries in the meantime, that we have very few people per company. In Switzerland, we had on average 2 to 3 people working with nanomaterials in one single country. How possibly can you do an epidemiological study with 2 or 3 people? So we have here now, we heard an example where they had like 20 people. We might find companies with 100 people, but still these are small cohorts. And we need to pool the data. And we need to pool the data across the globe to make a rapid progress. And the problem is right now that still each researcher who's doing that, I'm talking specifically of research because you might find even within an entity, within an institute, sometimes 2 or 3 different approaches to do the things. Still doing their own approach, and we are not yet on a place to have the same format. So how can we pull data if the data is totally differently structured, if we measure totally different things and we have no clue how to compare these data? So there's another challenge to nano that was, well, it's just a little bit additional complication. If you think of VOC exposure, let's take toluene, let's take benzene. You can express that exposure as a number. Yeah, for example, 20 ppm. And then, of course, you have to think of how much gets uptake, what is then the organ dose, and so on. Usual challenge. Well, particles, most likely, we have to consider the size number distribution, mass, something about the surface, reactivity, morphology. You will not be able to reduce particle exposure to a single number. So we're talking here about combined effects. In the past, people tended to just ignore it, treat one by one, or in the case of VOCs, you would just take equivalent dose, because there you would see quite similar effects. But it's likely here that we cannot just do that approach, and we have to really look into the mathematical treatment of the data. So we need to think of combination effects as a default, how we have to treat our data. So that means, for me, we have to involve statisticians that know what they are doing and that can help us with treating combination effects. Another challenge, if you want to do the pooling worldwide, is that we have a fragmented world. We don't have just the different continents, as you can see, or if I would show the political map, we have, of course, different countries, but we have differences in literacy, in age, in poverty, in peacefulness, and each of these factors has major impacts on the health of the people on site already, and their attitude towards health, and in which fields they give priority to health. So this is the nice idea. Let's unite them under the United Nations. And why don't we want to do also something under the umbrella of the United Nations or the World Health Organization, and bring the different WHO collaborating centers of the different continents together, plus additional research institutes that do health assessment, and try to get a hold of this defragmented world to bring some harmonization of what we're doing. So I talked already about these challenges that we have. We need to have a standardized approach for exposure assessment, standardized approach in the sense of at least a minimal number of data sets on exposure that allow us to bring get a better understanding of what does the exposure really look like at the different places, and the same on the occupational health. On the occupational health reporting schemes we have to get a hold of, and also of the occupational health parameters that we assess. And the insight we had in Keystone was that we want to do this together. So these questions that I outlined before, we should address them together. We set up a roadmap how we can do that. On exposure, we have already had several good workshops now under the leadership of TNO and NIOSH that were held in the US and in Europe multiple times. So we start to get there an understanding. On health, we are still in an earlier stage. We had some discussions. We want to meet again at EPICO. We want to meet again at NanoEH in Nagoya to continue these discussions. And then the risk management and studies designs, we start to talk together in OECD, in ISO meetings. And so we have now to get these together and bring the exposure and health and the risk design people together. We have a long list of questions that we have now to tackle. And I just want to refer to the document that we created. Where is it? Oh, I don't have here. Okay, you can ask me afterwards, or you can just look at for roadmap and nanomaterial workers, and you will find it. We just published it in the Journal of Occupational Medicine, this roadmap. And these are just the centers that want to work together. And what we now need is the funding. It's the usual game. We still try to convince the European Commission to put into the Horizon 2020. Right now, the signals we get is that they are not interested, but maybe we can twist an arm and they still will do it. And if you have a voice, and if you have a good contact to your national representative in the European Commission, who can tell something about what's in the Horizon 2020, then please put in a pledge that we need money to harmonize our occupational health efforts and money to do the occupational health studies. And with this, I would like just to thank you, and I would like to thank all the people that actively worked on this roadmap.
Thank you very much. Michael, if you agree, we can, on the last speaker,
Absolutely.
then if you want to stay to share with us